Welcome to Caregiver Cast with Mary Elaine Petrucci. Are you overwhelmed raising a family, working full time, caring for a parent or grandparent? It can be challenging when you're doing it alone. Caregiver Cast helps busy, burned out professionals reduce their stress and overwhelm to create a better caregiving experience for themselves and their loved one. Caregiver Cast brings caregivers together with experts who provide information in a variety of areas. In each episode, you'll get tips on topics such as finance, legal, medical, self-care, community resources, mindset, and more. We're here to make your caregiving journey a more rewarding one. Acquire the confidence and skills to be a more capable caregiver by implementing the resources and strategies from these expert thought leaders. Get a community of support, resources, and strategies for your caregiving journey inside the Caregiver Lifeline community. Visit caregiverlifelinecommunity.com. And now here's your host, Mary Elaine Petrucci.
Hi, I'm Mary Elaine Petrucci, your host for Caregiver Cast. My guest speaker is Dr. Forrest Jones, who will be talking to us about how family caregivers can find joy. And I will let Dr. Jones just give you some background information about himself, and then we will start the interview. So welcome, Dr. Jones, to Caregiver Cast.
Hi, Mary Elaine. It's so good to get back together with you again. We had so much fun last time.
Oh, we did.
And just glad to be here today. I'm Forrest Jones, MD. I am a retired family physician. I did my training at Northwestern Feinberg School of Medicine and my residency in family medicine at Cook County Hospital in Chicago, which was a lot of fun.
Oh, I bet. I've heard many stories about Cook County.
For sure. One thing is the hospital is still there, but most of the clinical care is not there anymore in that particular building. But the building is literally one block long, one Chicago city block long.
Wow.
And there were times when I'd have a patient on one end and they had services on the procedures or whatever on the other, blood, lab, things like that on the other end. We had to walk that whole block. So I got plenty of exercise.
I bet you did. Was it just one level or was it multiple floors?
Multiple levels, yeah, depending on which service I was on at the time, whether it was internal medicine, whether surgery or whatever. There'd be on suites on different floors and their patients would be on different floors. But after I had finished there, I practiced in family medicine. And the last 15 years or so of my practice life was focused on chronic illnesses in seniors.
Yes.
And that's where I really began to get more interested in that type of practice. And of course, I would have a lot of contact with family caregivers, spouses, children, sometimes even grandchildren who were the primary caregivers for my patient. And I started to pay attention to that and would see the challenges there. But actually, I didn't get to become aware of a number of challenges until after I retired and started exploring what I'm doing now, which is helping family caregivers and supporting family caregivers. But one thing I did do when I was in practice would be to encourage the caregivers and also to let them know that I cared about their welfare because they're really the center of the care plan. It's not it's not the doctor. Even I'm a primary care physician and trained to be quote unquote the head of the healthcare team for my patients. When it comes down to it, it's really the family caregiver who is the center of that plan. And one of the things I try to do, one of the concepts I want to carry forward in what I'm doing now, which is Caring End LLC, is to help caregivers see themselves as the leader of the care team and help to equip them to play that role. And one way I do that is to help them to partner with their doctors, partner with their loved one, partner with themselves. And from our conversation last time, you said you were interested in the partnering with themselves component. Yeah.
Yes. starting there, thank you for introducing yourself. I do commend you for working in Cook County because I've heard that it's a very challenging place. So to live through that and experience all that, kudos to you. How Give us an idea, Dr. Jones, of how caregivers can partner with themselves in order to be more effective in interacting with the physician and with the person that they're caring for. Can you give us some idea of how that would
Yeah.
into the family plan?
One thing that I think is probably key, and it's interesting that you wanted to focus on partnering with yourself, family caregiver partnering with themselves, is because in my discussions and interactions with caregivers, one thing that seems to be overarching everything
Mhm,
is um, how they can take care of themselves, particularly when they're trying to provide
mhm.
social and emotional support for their loved one. That's
Yes.
a huge challenge. Um, one way I would address that, because I became aware of that in my practice, one way I would address that was to take the caregiver's blood pressure.
Ooh. Mm.
Right.
Oh, that is really a great idea.
I would take their blood pressure because one, I knew that they place a priority on their caregiving responsibilities,
Yes.
and they're going to put that first.
Mhm,
And and to sometimes to the detriment of their own well-being.
mhm.
So I would do that just check to see if their blood pressure was okay. But I would also do it to let them know that I cared about them as the head of the care of their loved one's care plan.
I really appreciate that. It's interesting that you mentioned about taking the caregiver's blood pressure. It was interesting, and I will now carry this forward. Um, a caregiver asked me to take their blood pressure, and I'm like,
Hmm.
no. And now that you mention it, I see the significance of that because, yes, they're in charge of so much. They're in charge of their own life. They're in charge of somebody else's life. And yeah, that small little um effort that you have given your caregivers, I can see why it makes such a difference to the caregiver because they know that they are being looked at as being important and significant, which is something that caregivers really um, find challenging because they feel like they're not seen, not heard, and
Yes,
they're just dealing with all this, learning about how to change, like a catheter or change a wound dressing. This is not what they've um, thought they were getting into. So,
exactly. And actually, when you talked about changing dressings and so forth, that's one of the roles that caregivers have in terms of medical tasks. But
mhm,
when you think about it, another role being coordination of care, by the time they get through coordinating physical therapies, nurse coming to the home, going to other appointments, seeing the doctor, and so forth,
mhm,
they really don't have time or even energy to schedule their own appointments.
they don't.
Because if they have if their loved one has a really complex set of chronic illnesses, there's a lot that has to be done there, and they have a hard time maybe even squeezing in their own appointments.
Mhm,
And so if we can check their blood pressure when they come, we've actually given them a benefit. But another reason why I would do that was I wanted to, like I mentioned, send a message to the caregiver
mhm.
that I value them a lot, because if from my point of view, if they're not able to do their job, it makes my job harder.
Oh, definitely.
It makes my job harder. Who's going to do this in the house? And then for the loved one in their care, it makes their life difficult because they
Mm-hmm.
may not even be able to stay in a home. They may have to go now to um, assisted living or even a nursing home or something like that
Right.
because there's no one else available. But I also want to send a message to the patient
Mm,
because a lot of times they take their caregiver for granted.
yes.
And sometimes there's really difficult family dynamics that are going on as well that can create issues there. And sometimes I go so far as to tell the patient and the caregiver. I said, okay, you can pick up your check at the front on your way out because you're my agent. And I actually tell the patient I've deputized her. She's my deputy.
Oh, nice.
And
Oh,
that's so important because
yes.
very
I
often
agree.
the caregiver has to really almost fight with the loved one to follow the instructions.
That is true. Sometimes
And
they
they'll
do.
say,
And I
yeah,
understand that completely, even with
sure.
my father trying to, make him happy or help him take advantage of an outside activity just to help me take a bath,
Yes,
shower.
yes, yeah,
And he would look at me like, really? So, well, it's your choice. You either take the shower and we go out, or you choose not to. I'm not fighting with you.
you have to pick your fights, don't you?
Right,
You have to pick your
exactly.
fights.
Right.
Yeah, yeah. And sometimes the patient will, either the patient will tell me directly or the caregiver will tell me that their loved one has told them, well,
Mhm.
Dr. Jones didn't tell me to do that.
Oh,
And
oh,
so that becomes their excuse because the
mhm.
loved one in their care is a human being. They're going to do what they feel like doing.
That is so true.
And
I
if
can
it's your
vouch
parent or
for that.
something, it's, you can't push too hard.
No.
Um, and you have to pick your fights.
Mhm,
And so when they bring those things to my attention, I'll just reinforce on behalf of the caregiver
mhm.
and explaining because I do want my patient to know that they're the one we're really taking care of. I don't want to talk around the patient. I
Oh,
don't want
that
to
is such
sit
a good
there and
point.
direct all my conversation to the caregiver because that's not right either.
No, because really it's up to your patient
Yes.
to follow your instructions. It's just up to the caregiver to take what you've given the
Hmm.
patient and
Hmm.
making sure that they're doing that activity outside of the doctor's office.
Exactly. And I do owe the patient their dignity. I owe it
Definitely.
to them. That's part of my job. If
Mhm.
I don't do that, it's going to negatively impact the health of the patient. It's going to
Mhm.
negatively impact the health of the relationship of the family caregiver to the patient. And even if the patient, I'm calling my patient, but even if they have some incapacity as far as their mental ability,
Mhm.
I look for ways to engage them anyway to let them know I'm talking to them, not around them or about them.
And
And
that's so important because
it
my mother
is.
had Alzheimer's. So at the very end, she was unable to communicate. I mean, she could with like
Hmm.
her facial expressions and her body
Hmm.
language. However, I did my best to even talk to her directly. I mean, it's like
Hmm.
you have to do that because
Hmm.
they're still a human being, like you're saying,
Yes, yes,
and
we
they
owe that
deserve
to
that
them.
respect. Um,
Yes.
and I remember times when I would take my mother to the mall to walk.
Mm,
She was a walker. And toward the
good.
end, she had Parkinson's as well. So she got to the point where she wasn't able to. And I would just say to her, that's okay.
Mhm.
We'll just take the wheelchair and we'll just go around and look at different things together. Um, it's okay. I mean, You've
Beautiful.
already walked a billion steps in your life. So let me just, let me help out.
Yeah,
So
that's
I would
beautiful.
agree with that.
Yeah, that's beautiful. Because also, one way I would do that would be to talk maybe in detail to the family caregiver about instructions, or maybe trying to
Mhm,
get more information. And then I would come back and give my attention to the caregiver, to the patient, and say,
mm,
this is what we just talked about. I was
mm,
just talking to your daughter about this and this. I was, you know,
mhm,
uh, when your daughter said this, is that what you agree with? Or this is what we were talking about that
mm,
we think would help. Do you like the way that sounds? And to
mm,
the extent that they can respond, sometimes they can
right.
respond, or many times, especially if they are more advanced in their loss of decision making, they're just satisfied that we had the conversation. They say, yeah, doc, I'm okay with that.
Mhm,
They don't understand everything, but at least by involving them in it,
right.
um, it reinforces the trust that they can have with their caregiver.
Well, not only with the trust with the caregiver, but trust with you,
Absolutely.
because there's three people in this room. You're all having this discussion, and
Yes.
um, it's really important to take everybody's input. And even if the
Yes.
person, like you said, like for example, my mother who had severe dementia, it they feel like they're that they're being, like you said, honored and respected, and
Mhm.
um that and they also appreciate that you're taking time to talk with the caregiver
Yes. Hmm. Hmm.
and um giving them the instructions so that
Hmm.
when they go home, the patient knows that their caregiver will be doing what
Yes.
you have instructed them to do. So
Right. Yeah.
I think there's trust among everyone, and I think that's so important. Um, you can't miss any of those pieces.
And you know why the trust is so important? And this is something that I think is important for us as doctors and the companies that employ us. So many of us now are employed, is somehow that's got to convert to dollars and cents.
Well,
And so,
totally. Yes.
yes, the more trust we have, the
Hmm.
less likely that person's going to go to the emergency room. That's
Exactly.
big bucks for the enterprises who are the deliverers of medical care. If
Mhm.
we can reduce unnecessary, if care is necessary, we got to do that. I mean, that's what we're here for.
Right.
But if there's not sufficient understanding, or there's misinformation,
Hmm.
misunderstanding, then people will go to the hospital emergency room and they really didn't have to. They don't want to go. Now, who wants to go there? But they'll go there because they think that's really the best decision under the circumstances. Well, if we can minimize those, everybody's happy. And especially if we can minimize people going into the hospital and then having to be on observation and all this kind of thing.
Hmm.
Um, if we can minimize those, everybody's happy as well. And so the more trust we can establish and the better communication we can establish there in the exam room,
Hmm.
we've made progress on that in that way.
Oh, definitely. I know people look at the ER as the end all be all. Like you're saying, it is the most expensive entryway into healthcare. So if
Excuse me.
I know myself, I've had to go to the ER because it was an emergency, but if I could have gone to a doctor's office or doing a televisit or whatever, that would have
Mhm.
been much more effective. And I totally understand what you're saying. Um, it's better to reimburse the physician, the family physician,
It is.
than to put all of that money into a healthcare system that is necessary. However, if we can avoid it, then everybody's better off.
Yes, absolutely, absolutely.
How else can a caregiver be partner with themselves as well as a doctor and with with the one that they're caring for, so they can be more effective?
I think another reason is for caregivers um, to be mindful and also to be appreciated for their sense of purpose.
Yeah.
You know, there's a lot of duty involved
Mhm.
that are there. And I think, in a way, women feel this more intensely than men just because of how our society interprets our roles.
Mhm.
And to some degree, that's not fair. Hopefully, that's changing some now. But still, um, there's that sense of duty that the caregiver feels. I owe this to my mom, my dad. Sometimes it's a best friend. Sometimes it's a neighbor that you've lived next door to for 20 years, and they're like family.
Mhm.
Um, but there's a sense of duty, and I think that should be honored.
Mhm.
And I think that's one way caregivers do feel a sense of fulfillment about what they're doing. It's kind of like a badge of honor
Mhm.
that you
Yeah.
feel you take a lot of responsibility for that. You take that seriously.
Mhm.
And that's what helps you go the extra, not mile, but 3 or 4 miles that you may be called on to do. And I think just owning that. Um, and sometimes I do hear that when I'm having conversations with family caregivers because they're not saying that explicitly,
Mhm.
but I see the sense of purpose behind that. And I do try to honor that as a physician because I want to take that seriously because that does, in order to honor that, the caregiver um, is making a lot of sacrifices.
They are, and much to the detriment of their own financial security in terms of their
Yes,
own career,
yes,
um, their ability to get promotions
yes,
and all of that. And when they have to kind of like drop out, um, it's a real big detriment even to the company that they were working
yes,
for, because they've lost a valued employee
yes,
who's invested
yes,
a lot of time with them. So I see that we're making small incremental change with some legislation about providing more incentive or more financial reimbursement for family caregivers. Um, it's just totally not enough. Um,
mhm,
there, I feel even with my parents, for example, we found that caregivers were getting about minimum wage, and that's
yes,
really
yes,
nothing that you can live on.
right,
Um,
yeah,
and now that a lot of them are leaving the workforce, we are going to be in a bigger predicament.
yes, yes.
So can you recommend a few like options that would be beneficial for caregivers for themselves so that they can be their own advocate while they're caregiving?
Well, I was going to say thank you so much for the work you're doing. And that's one of the reasons I'm so glad that I've come to meet you because I'm not, uh, certainly before I started this journey, I was not aware of the need for those resources,
Mm,
or the degree that many are making as far as the sacrifices. A lot of caregivers take early retirement, for example,
Yes.
just for that reason, before they were really ready to or really financially prepared to. They had
Hmm.
to take that
Yeah.
because the caregiving needs would keep them so often away from work anyway that it was just this was actually the easier solution.
Hmm.
But there are some changes coming online. I know that you're pretty active in keeping up with those changes and opportunities, and I look forward to working with you on that area as well.
Well, thank you for that. I think it's really important because we're both needing to advocate for caregivers because we're
Mhm.
going to have a caregiver crisis in
Absolutely.
2030, and where there's going to be 76 million more baby boomers who will be retiring,
Wow.
be no one to care for them. Employers and government officials need to be more in tune with what could and will be happening. It's starting now, of course, because of COVID, but it's going to really accelerate the problem in 7 years. So I think any way that you and I can advocate and treat caregivers as a vital part of the caregiving journey, I think would bring more value to people who are actually doing it. And they wouldn't feel so financially strapped
Yes, yes.
in terms of
Um,
doing that.
yeah, absolutely. And we'll get into this more later.
Hmm.
But that's one of the benefits I see with the membership community that I'm starting.
Hmm.
That'll give me the opportunity to talk to more family caregivers and hear what their needs are.
Hmm. Yes.
And then I can not only help to advocate for them, but also help them to advocate for themselves
Hmm.
and in turn their loved ones. Because so much of the advocacy that caregivers are doing for themselves is really about advocating for their loved one in their care. And
Right.
so, however, we can support them in that job, that also helps caregivers take care of themselves as well because they can feel they have more peace of mind about what they're actually able to accomplish. And that's so important because such a sad thing that can happen to caregivers is that they pour in all their blood, sweat, and tears, and they're not appreciated by the doctors who don't give them time or access. They may not be appreciated by the family members,
That's a really good point.
siblings and so forth. And then often, I don't know if I can say often, but more more than I've been realizing is not appreciated sufficiently by the loved one that they're caring for. It's really a blessing if you have someone you're caring for who really appreciates and tells you that they appreciate what you're doing.
Hmm.
Um, but I've seen situations where no matter what the caregiver does,
Hmm.
the one in their care is not satisfied, and sometimes uses that as a way to control and manipulate. And so we need to support caregivers in those type of difficult settings because that's horrible.
I would agree. And I think it's unfortunate that the person receiving care in that situation um, doesn't really appreciate the sacrifices that you're making, and that they could be they could be in
Mhm,
a long-term care setting, and that could be worse than what they're getting
mhm.
at home. So I understand.
Can I
Um,
add something there? Because
sure.
to the so if you have someone that you're taking care of who has that type of attitude, one thing I try to look for are signs that that loved one who they're caring for has a lot of anger and resentment.
Yes.
Because it's, when you into a chronic situation that is having you become more and more dependent,
Yes. Uh-huh.
and you are having a hard time with that, accepting that,
Hmm.
you can turn that anger and resentment on the caregiver.
Yes.
And so those are issues as well that we want to be mindful of and see how we can support the caregiver there. They can't really fix anybody if that's where they're coming from. But as they say, getting old is not for cowards. And someone who's being cared for and becoming more and more dependent, that makes it hard for them to face each day. And so they may turn that anger and resentment on the caregiver. So we want to be mindful of those types of things as well and see what we can do to help in that way too. So that's another angle of the helping the caregiver
Hmm.
take care of themselves. If I can just bring that up as a point.
Oh, definitely. I can give you a specific situation.
Mm,
My One of my aunts was
mm,
taking care of her mother. Um, However, her mother would prefer to have her younger daughter or another
mm.
daughter
Yes,
take care of her.
yes.
And the situation, which I'm not here to judge, the other sister had married into a wealthy situation,
Hmm.
and for whatever reasons chose not to take care of her mother, even though her
Hmm.
mother would have preferred her to take care of her.
Hmm.
So in some ways, she was taking it out on the daughter
Yeah,
who was left to take
I've
care of
seen
her.
that.
And
Yes.
um, so just to bring it forward more, it's, my aunt really had to then put her mother in a long-term care setting and move
Hmm.
her further away from where
Wow.
she lived because it was too stressful for her to always go and hear that her mother wanted the other daughter
Yeah,
to be involved in her care, and for whatever reasons chose not to.
yeah,
Um,
yeah.
and yeah, so
Hmm.
I've seen that perspective
Yeah,
as well.
that's unfortunate. I'm thinking that I'm wondering as a physician how much impact we might have had if we were her primary physician,
Yes.
because I have made the point more than once to a difficult patient I say, you need to take care of your daughter,
Right.
you know,
Right.
um, and, um, and sometimes I would joke with that. I would say, let's say that issue is not really a strong issue there when we're talking in the office. As I'm closing,
Hmm.
I would tell the patient, be sure to take care of her for me because I need her.
See,
And yeah,
I so appreciate that.
and because I want to because I know how
Mhm.
things can get. And then another thing is, I've actually more than once told the patient, if she's not here, who's
Mhm.
going to take care of you?
Mm,
And I
that
put that in
is-
the context
yeah.
of something that's kind of a difficult thing I like to
Mhm.
bring up, which I try to schedule. What are resources we can do to schedule respite times for the family caregiver? That's another
Mhm.
thing we want to talk about as far as how caregivers can take care of themselves. I know that's something that you're
Right.
active in too, in terms of how we can, what's going on to make more respite facilities available.
Yes.
But say they are available, very often the patient doesn't want to use them because they misinterpret this as she's trying to put me away or she doesn't want to take care of me. And that brings up in other words, the idea brings up a lot of insecurity on their part and fears on
Mhm.
their part. And so
Right.
I'm trying to put this into a context saying that, you know what, the way things are going now for your daughter or your son, whoever your caregiver is, this is not sustainable. this is not, I said, they've been working real hard with you, but I don't know if you realize how much this is taking out of them. I'm afraid for their welfare. This is not sustainable. And
Right.
so let's see what we can do to make this more sustainable. Respite is a key part of that as an
Right.
opportunity. But I also mentioned a couple of things. I mentioned that's one reason we want to be sure that we can build in rest breaks for the caregiver,
Mm-hmm.
but also we want to basically stress test the system. What I mean by that, there may be
Okay.
situations where the caregiver needs to get away because maybe they need to get some medical care themselves. I've
Mm-hmm.
seen caregivers,
Right.
their doctor, their own doctor has been trying to schedule them for surgery, and they've been putting it off, putting it off, putting it off because they don't have anybody to take care of mom, or if
Yes.
they're in the hospital, they're trying to leave really before the doctor is ready for them to leave because I got to get home and take care of mom or dad.
Yes.
Well, we don't want to put that kind of stress on and then also I know even for in my family, my father, he's gone now, his wife wanted to attend her grandson's high school graduation.
Mm-hmm.
They're in Florida. His graduation is in California.
Mm-hmm.
She wanted to get away. Well, certainly that's something she should be able to do. Well, it's nice to have a respite facility that you've been using all
Yeah.
along
Mm-hmm.
where you have had a chance, okay, out of the ones that were available, this one seems to meet our needs the best. This one we have a comfort level with. And so if I need to get the respite
Mm-hmm.
planning
Mm-hmm.
also creates a way for the caregiver to not only to get away, maybe for their own health needs or sometimes just for other important family events,
Yeah. Totally.
significant family events.
Mm-hmm.
And when they can do that, they can do that with confidence, uh, without feeling guilty,
Mm-hmm.
because that's a big thing that can happen to caregivers because that duty piece,
Definitely.
doing this out of duty, can
Mm-hmm.
come back and have a negative impact of making me feel guilty for something I'm really should be entitled to. So,
Mm-hmm.
yeah.
No, I agree with that. I've also talked to someone who's been a caregiver and for a husband for a long time. And she feels that she has to do it all because she's had other
Yes, yes,
caregivers. She's had other caregivers come in
yeah.
and they don't meet her expectations or a husband's expectation.
Mm-hmm.
So she feels like she has to do it all, regardless of the need for respite for herself, because she feels like she's the only one that can provide her husband with
Yeah,
the care that he needs, and that training someone else is just a way, it's just too much for her to
yeah,
do.
yeah, yeah.
So how would you intervene in that situation when somebody feels like nobody can do the job as well as they do?
Excellent point. Excellent point. That's really a need for some conversations,
Mm-hmm.
and to find out where those expectations come from. Sometimes they're legitimate. I've seen it in cases where um, people, the patient and their loved one, have had bad experiences,
Mm-hmm.
especially if the patient themselves have complex medical conditions
Mm-hmm.
that have been misunderstood
Mm-hmm.
by the medical professionals
Mm.
that have actually been life threatening
Wow.
to them.
Mm.
And so, yeah, I mean, that's a serious consideration.
Mm.
But other times it's really a matter of preferences where either the patient or the loved one or both, if we really start talking to them, maybe we can actually help to loosen up the intensity of those expectations, and
Mm.
basically talk in terms of risk benefit. Some people,
Yes.
sometimes
Okay.
that'll come out of, for example, there's just sometimes the patient is just very selfish and self-centered, and they just want things their way. But there are other times that there are other types of, and if they're really fixed into that, that's a really hard one to break. Or sometimes the caregiver themselves have a very rigid idea of what caregiving is.
Mm,
Sometimes, we got to say this too, sometimes that comes out of a controlling nature in the caregiver.
yes, or
So
a
there's a
guilt
lot of different,
building,
yeah,
feeling like the person, like their spouse isn't able to do what they
yeah,
had been able to do in the past. So
codependency issues,
yes.
and all these things can come up. We're talking about human beings now, right? We all
Mhm,
have things we struggle with, and these things can start to impact these relationships. And so we
mhm.
want to explore that. And one of the outcomes we want to be able to come out of that is where we can find ways to give the caregiver permission
Mm,
to take care of themselves in different ways. And sometimes that may take a period of time to just kind of work through for the patient and the caregiver um, these what that can mean.
mhm.
And I'll say this, and then I'll conclude. My attitude now is compared to when I was a new physician. I can't fix these things. It's not for me to fix. A lot of times it's okay, what's an adjustment? What's an adjustment we can make, you know, that can make things easier and better?
Right.
Because when we talk about trying to fix something, what does that even mean? We don't even have the level of understanding sometimes of all the circumstances
Mhm,
involved that are interrelated,
mhm.
that impact what we're looking at. And so if we look at, okay, what's the squeaky wheel? Let's
I
put
love
some
that.
oil there.
Yeah, but I
And a
love
lot
it.
of times you get a lot of benefit out of just a little oil in that squeaky wheel, but it takes some time to figure out, okay,
Mhm,
what'll work. So can
definitely.
I tell you where your listeners can get back, learn more about what we're doing? Yeah.
Oh, most definitely. Yes, do that. And while you're doing that, just, I guess, sum up like the three major points that can help
Yeah.
caregivers advocate for themselves. And yes, I would like people to get in touch with you, Dr. Jones, because this is such critical information for caregivers to have. So please go ahead.
Right. I forgot all the three, but I think I'll start with be easy on yourself. Be
Great
easy on
advice.
yourself. Yeah.
Uh-huh.
You don't have to know everything. You don't have to do everything. You don't have to be everything, although so often it pretty much seems that that's the way it is.
Hmm.
But the second is acknowledge your purpose. Uh, you are standing up at this time out of duty because you do see the responsibility here. You take it seriously. We want to honor you for that.
Hmm.
And I would say related to that, if you have a medical provider or doctor who is not recognizing that, find another one if
Hmm.
that's possible,
Okay.
because that type of support really is important for this to be a sustainable effort for you
Hmm.
and for you to have the peace of mind that you deserve to have. And when all is said and done and your loved one has gone on, for you to have peace of mind about that as well.
Hmm. Definitely.
Yeah,
Thank you for sharing those three.
yeah,
And yes, be easy on yourself. Acknowledge your purpose and find a supportive primary care physician who will help you in your caregiving journey. Perfect
exactly.
advice. So how can our listeners reach out to you?
There are two ways they can reach out to me. One is to go to my website, www.caringin.com, caringend.com. And also, you can take my caregiver quiz, and that's something that's a free that I like to offer for your audience.
Thank you.
Just caregiver, one word, caregiver.com. And basically that's an assessment
Mm,
to help me and you understand where your strengths are
okay.
and also where you can seek support and help.
Mm,
And when you go to my webpage, www.caringin.com, you'll see a yellow button at the top, which invites you to join my membership
nice.
community, which I've
Mhm.
just started. And it is a paid membership. And for people coming in now, this is just starting $15 a month.
Mm,
And what I want to
right.
offer there is a community where you can share experiences and benefit from the experiences of others,
Mhm.
share your encouragement, benefit from their encouragement. Twice a week, twice every 2 weeks, I'll be in there for a live um, a presence where we have Ask Me Anything.
Mhm.
Okay. And
Yes.
then once a month, I will be giving a topical webinar, just maybe 15, 20 minutes of topical information. And then the rest of the hour, I
Mhm.
want to devote to any questions that you might have around that topic. Because
Great.
one of the things I want to provide is helping caregivers gain skills that they may not have
Mm,
or share skills that they do have.
yes.
And also with the community, you have a solution to isolation.
Mm,
So many caregivers, especially if their loved one has advanced care needs, they never
yes.
get out. They
They
never
don't.
get out.
You're right.
And
They don't.
that's so critical.
Mm,
And that was worse during COVID, of course, but even now that COVID is over, many of them don't have the opportunity to socialize or get out or to have people even understand what they're going through.
mhm. I
So,
think that's
yes.
a great resource. Thank you for sharing
Hmm.
that you're opening up this community for caregivers and that you will be sharing your wisdom that you've gained in your own medical practice. And I think I want to just remind people in my community to go to caringend.com, sign up for the community, and just learn from each other, learn from Dr. Jones, and really get your needs met in a healthy way. So, Dr. Jones, thank you so much for being here today and sharing how family caregivers can find joy. So thank you so much for being here.
It's always fun talking to you. And again, I appreciate the work that you're doing and look forward to interacting with you again because with work that you're doing in terms of keeping up with policy changes
Yes.
and so forth, I can definitely benefit from that and even pass that information on to the members of the community because caregivers, I'm sure, want to know what's going on that will help
Mhm.
them and that there are people who are like yourself who are advocating for them on that level. Yes.
Thank you so much. Um, I think I will put you in touch with the National Aging in Place Council because I think you'll be
Thank
a
you.
great resource to have on their advocacy committee. So thanks
Perfect.
again, Dr. Jones.
Thank you. Enjoy your day.
You too.
Bye.
Thank you for listening to the Caregiver Cast today. Get a community of support, resources, and strategies for your caregiving journey inside the Caregiver Lifeline community. Visit caregiverlifelinecommunity.com. Get involved with the show. Send your email to mpetrucci2002@gmail.com. And we'll see you again next week for another episode of Caregiver Cast.